As you notice, I've split Medicare Advantage plans into two separate videos. The reason for that is that a Medicare Savings Account, or MSA, is technically a Medicare Advantage plan. The workings of it and the coverage of it is completely different than a Medicare Advantage plan, but CMS still has it as a Medicare Advantage plan. So we'll go through the basics of an MSA here, separate from a standard Medicare Advantage plan.
To start off our discussion on the MSA, Medicare Savings Account, we're going to, as always, start with the Medicare and You Handbook, this one for this year, 2016. There isn't a whole lot of information here. We'll go into a little more depth. CMS actually has a handbook dedicated to MSAs, or Medicare Savings Accounts, and we'll get the bulk of our information from there. What it does have to say, and it's under Medicare Advantage plans, like I had mentioned before, is that these plans combine a high deductible health plan with a bank account. Medicare deposits money into the account, usually less than the deductible. Actually, it is less than the deductible. And you can use the money to pay for your health care services during the year. If any of you have had experience with an HSA, either through a group plan at work or an individual plan, it operates on the same basic principle. You have a deductible. With an HSA, you would put money into the account. With an MSA, Medicare actually puts money into the account. MSA plans do not offer drug coverage. They do cover the Part B drugs, for instance, chemotherapy drugs, things of that nature. Any prescription or drug that Part B would cover would be covered underneath this. Just with a Medicare Supplement, you would need a Part D prescription drug plan along with this. That's about all it has to say concerning the MSAs. So we'll take a look at the booklet that they put out especially for that type of plan and go through some of the finer details. Here is the CMS guide to Medicare savings accounts. As we discussed earlier in the video, they go through in more detail on how the plans work and what the specifics are as to joining a plan, leaving a plan. If you would like a copy of this yourself, you can just give us a call and I'd be happy to email one to you. As far as who can join the MSA plan, people with both Part A and Part B can generally join unless you have coverage from an employer or union group. If you have TRICARE, if you're getting benefits from the federal government employee program, you're eligible for Medicaid, you are currently in a hospice, have end-stage renal disease, or you live outside of the U.S. for more than 183 days. All those reasons will disqualify you for being able to participate in a Medicare savings account. MSA plans work by providing coverage for your Part A and Part B. If you decide to join an MSA, you will get covered health care through a high deductible Medicare Advantage plan. Again, this is how they classify it as an Advantage plan, but the workings are considerably different. You won't have to pay a monthly premium for this plan. You will continue to pay your Part B, which right now is right about $122, but you will not have any additional premium. This plan will only pay for Medicare covered services, and that is pretty much the same with most Medicare Supplement plans and Medicare Advantage plans. Some may cover little pieces of non-covered medical expenses, but for the most part, once you're on Medicare, you are tied to the Medicare approved charges. This plan will not pay any benefits until you reach your deductible. The deductible can vary by plan, and like I mentioned before, an MSA does not cover Medicare prescription drugs. If you join a Medicare MSA plan, you will need a Part D drug plan. And here's the basics of it. When you join a Medicare MSA plan, you will need to set up a special account. That is actually done by the provider for you. They set up an account. These plans have to be done with a face-to-face appointment because the banking information needs a wet signature. It cannot be a copy, which means it can't be faxed. It has to be mailed in. So I would come out to your house, sit down at your kitchen table, fill out the application. Medicare pays a set amount of money to the private companies for the Medicare Advantage plan. In a Medicare Medicare MSA plan, the plan gets additional money from Medicare that it deposits into your account. So just like a Medicare Advantage plan, they get paid by the government to offer the plan. With this type of plan, they also get extra, which they will put into an account for you, which helps on that deductible. And I'll show you an example as we get down a little further. Only the plan can make a deposit into your MSA account. You'll have your account with the money that Medicare puts in it. You'll pay first out of that account for your Medicare or doctor or hospital costs. Then the rest would be out of your own pocket. You cannot add back into it. The money deposit into your MSA account and any interest it gets. Now this money will be put in every year. So if, for instance, they put in $1,600 this year and you didn't do anything, you never went to the doctor, never had anything, the next year another $1,600 is going to go into that. That will go in every year. Could, depending on your spending, could draw interest, or earn interest is a better way of putting it. The money deposited into your MSA account and any interest you get isn't taxed if you spend it on a qualified medical expense. And that is a list that is put out by the IRS on what is a qualified medical expense or not. If you spend it on something else, you decide you want to spend it on dinner, you will be taxed on that money that's drawn out of that account. Now that we have the specifics of what the plan is, I'll give you an example of the actual benefits. This is the carrier that I have for this type of plan. To my knowledge, there are only 2 in the state of Wisconsin, and I don't know of any that are outside of Wisconsin. How much is the monthly premium? You pay nothing for your Medicare monthly plan premium. Medicare pays this monthly premium to the provider. You will have to pay your Part B premium. That's pretty much a death do us part type deal. The deductible is $4,000 per year, but before you gasp at that too much, how much does Medicare deposit into my MSA bank account? Medicare will deposit $1,605 into your account. So they're giving you $1,605 towards that $4,000 deductible. That means your share or your out-of-pocket cost would be $2,395. Your exposure would be $2,395. Here's some basic services. Chiropractic care, you pay nothing after your deductible. Diabetic supplies and services, nothing after your deductible. Diagnostics, labs, and testing, nothing after your deductible. So you basically have a $4,000, 100 type of coverage. You're going to pay the $4,000 deductible with their $1,605, your $2,395 equals the $4,000, and you're done. If you don't spend that, that's fine. You don't have to, and like I said before, that $1,605 is going to be put into your account every year. It gives you control over what you're going to pay for services. Now this is all based on the Medicare prices too. So that doctor can't charge you the same as he would a non-Medicare. Now this is one of the reasons that I like this above and beyond a Medicare Advantage plan. A true Medicare Advantage plan, you're going to have to stay in network. They're either HMOs or PPOs. There are some private fee-for-service out there, but they're fastly fading away. With a Medicare Supplement, you get 100% coverage and can see any doctor in the United States takes Medicare. With this plan, you have a high deductible, $2,395. You have their $1,605, $4,000, and then you are 100% covered. And right here, you can go to any doctor, hospital, or other provider that accepts Medicare payment and the plan's terms and conditions. There are no networks. Just like a Medicare Supplement, you can go to any doctor that accepts the Medicare as long as they're willing to run the billing through this plan, which so far has not been an issue with the clients I have on it. So unlike a Medicare Advantage plan, there's no networks. It's low cost, zero premium for the plan, and then 100% coverage after your deductible. May not be the fit for everyone, but it is an option for us here in Wisconsin. If you'd like more information, give us a call, 545-4884 or fill out one of the contact forms in this website. Thank you, and I hope this information has helped you.